Bon après-midi, good afternoon, everyone. Cet après-midi, Dr. Jennifer Russell, médecin hygiéniste en chef, et le Premier ministre Blaine Higgs prendra la parole. Dr. Jennifer Russell, Chief Medical Officer of Health, and Premier Blaine Higgs will address you. Thank you. Dr. Russell.
Good afternoon. Bonjour. The coronavirus pandemic is a serious and unprecedented challenge to New Brunswick and all our people. We are now faced with a public health emergency, and we must all act in accordance with the advice of public health experts. That means that everyone who possibly can should stay home. It means limiting your contact with people outside your home to the greatest extent possible. Staying home will save lives. It is as simple as that. To date, the provincial and federal governments have taken significant actions to make it easier for people to follow this recommendation. But I have to tell you that I am concerned that we are still not doing enough to flatten the curve of this pandemic, to support our healthcare system in managing this crisis, in preventing further illness and saving lives. I would support the enactment of emergency measures by the Government of New Brunswick to ensure compliance with public health directives. Mais je dois vous avouer que je crains que ces mesures ne soient pas suffisantes pour aplatir la courbe épidémiologique et pour soutenir notre système de santé, afin de lui permettre de bien gérer cette crise, de prévenir d'autres cas de maladie et de sauver des vies. Le cas échéant, j'appuierai l'adoption de mesures d'urgence par le gouvernement de Nouveau-Brunswick pour assurer le respect des directives de santé publique. As of today, we still have 11 cases of COVID-19 in New Brunswick. The case count is as follows: 4 confirmed and 4 probables, and we have tested 410 people. 410 people have tested negative in the provincial laboratory. À ce jour, on dénombre toujours 11 cas de COVID-19 au Nouveau-Brunswick. Voici comment ces cas sont répartis. 7 cas confirmés, 4 cas probables, 410 personnes ayant eu un résultat négatif au test de dépistage effectué par le laboratoire provincial. Remember, we must each take responsibility for our actions. Please stay home with your families and limit your contact with others. When you must be in contact with others outside your home, try to stay at least 2 meters or 6 feet apart from other people. Make sure you wash your hands frequently and cough and sneeze into your elbow. These are stressful times, and we must all do our best to manage the stress we are all feeling. There are things that you can do to take care of yourself. You can eat healthy, get some fresh air, some balanced meals, and get regular exercise and plenty of sleep. If you experience stress reactions in response to COVID-19 for several days in a row, and you are unable to carry out normal responsibilities because of them, contact your healthcare provider or your local addictions and mental health center. Help is also available through Kids Help Phone by visiting their website at www.kidshelpphone.ca. You can also text TALK, T-A-L-K, to 686868 to chat with a volunteer crisis responder, or call 1-800-668-6868. Je vais répéter ça en français. Alors, vous pouvez parler ou texter à parler, P-A-R-L-E-R, le 686868 pour parler avec quelqu'un ou à quelqu'un sur la ligne de 1-800-668-6868. You can also contact the CHIMO helpline at 1-800-667-5005. So that's the CHIMO helpline, c'est 1-800-667-5005. Thank you.
Good afternoon. Bonjour. After serious deliberation with my cabinet colleagues and the all-party cabinet committee on COVID-19, it is my duty to inform you that the government of New Brunswick is declaring a state of emergency today under the Emergency Measures Act. I want every New Brunswicker to know that this is a step that we are not taking lightly or without serious consideration of its impact. Je veux que tous les gens de New Brunswick sachent que c'est une mesure que nous prenons très en sérieux et que nous prenons très bien son impact. Most New Brunswickers are acting responsibly and following the advice of Dr. Russell. They are doing this because they know that staying home and maintaining social distances will save lives. But it has become clear that there are still too many people in our province who are not following the advice of our public health officials or are deliberately ignoring them. This has compelled our government to take these extraordinary measures. Under the Emergency Measures Act, we have issued a declaration of emergency and mandatory order which compels businesses, their employees, and members of the public to act in the interest of flattening the curve of this outbreak. En vertu de la loi sur les mesures d'urgence, nous avons émis une déclaration d'urgence qui oblige les entreprises, leurs employés et les membres du public à prendre des mesures pour aplanir la courbe de cette explosion. Effective immediately, we are ordering the following actions under Section 10 of the Emergency Measures Act. Public schools, universities, and colleges will remain closed until further notice. All retail businesses must cease to admit the public, but may continue with online or delivery sales. Exemptions will be made for the following: grocery stores, pharmacies, stores operated by NB Liquor and Cannabis NB, automotive repair businesses, post offices, gas stations, hardware stores. All food and beverage serving businesses will only offer takeout and delivery services. All bars and other establishments operating under the Liquor Control Act will close immediately. Hairstylists, barbershops, spas, and nail salons must cease operations. All construction activity is prohibited with the exception of repairs to maintaining key public infrastructure. In this regard, the point is to avoid public access. Construction activity that is not public facing, that is not a situation where we're working in an area that does not see the public interact every day, we can look at those services as independent, but not exposing the public or the workers that work there. All cinemas, theaters, gyms, tennis courts, dance studios, and other recreational and public entertainment facilities must stop admitting members of the public immediately. Any premise where people typically gather in large numbers must take all responsible steps to prevent gatherings of more than 10 people. All facilities that do remain open will reduce to critical function and will take every reasonable step required to prevent people who exhibit symptoms of COVID-19 from entering the workplace. They will also take every reasonable step required to prevent people from entering workplaces who have traveled internationally in the previous 14 days. In addition, employers will be required to take all reasonable actions to ensure employees who are at work have not been exposed to the virus and to ensure their compliance with self-isolation if they have been exposed. Anyone who has been outside the country, who has been advised to self-isolate, who has been advised by a physician to do so, must now, by law, comply with these directives. These are unprecedented actions, but these are necessary as we are in unprecedented times. This will provide us with the tools we need to ensure the safety of New Brunswickers. The message we're sending to the people of New Brunswick today is the same as we've been saying over the past week. Residents who are not essential workers need to stay home. Businesses who are not public-facing can continue to operate, but they need to do so by protecting their workforce and following all compliance rules around distancing. They need to do so to ensure that the spread of this virus is not allowed. Notre message aux gens de New Brunswick aujourd'hui, c'est le même message que nous répétons depuis une semaine. Les résidents qui ne sont pas des travailleurs essentiels doivent rester à la maison. You should only leave the house for groceries and other essential items. If you must interact with people outside of your household, maintain a distance of 6 feet or 2 meters. Before, this was a recommendation. Today, it's a requirement. I feel strongly that the decision to declare a state of emergency is the best way to protect all New Brunswickers and to avoid the dire situations that we're seeing in other places around the world. Je suis convaincu que la décision de déclarer l'état d'urgence est la meilleure manière de protéger tous les gens de Nouveau-Brunswick et d'éviter les situations difficiles que nous avons vues à d'autres endroits dans le monde. I know that many residents are experiencing unexpected economic impacts because due to the nature of their job, they may not have the option of working from home. Therefore, part of the emergency declaration will suspend the authority of landlords to evict tenants for non-payment of rent through May 31st. We are still analyzing the federal aid package announced yesterday, and we will continue to evaluate the details and identify any gaps in the support of impacted New Brunswickers. I know many will be concerned by our decision to declare a state of emergency, but I'm confident that these measures will result in New Brunswickers taking the actions necessary. The safety of all residents must continue to be our key priority. I mentioned the analysis of the federal package. We will continue that today. Tomorrow, we'll bring updates precisely on what that means to New Brunswickers and identify as many areas as we can in terms of any gaps that exist and what the fund that's been proposed actually provide. It's important that we all do our part to contribute to this goal of saving lives and protecting citizens. I believe we can do it. I believe we can not only flatten the curve, we can ensure that we maintain a very effective healthcare system for all through this pandemic. Thank you. Merci.
Mike Angus of Media Q. Mike? Silas Brown, Global News.
Premier, would this declaration, would this allow the province to potentially jail people who do not follow self-isolation rules being put in place by medical professionals?
At this point, I think I want to emphasize that this goes from a recommendation to a declaration and a requirement. Yes, it does give those sort of authoritative rules, but that is not our intent, nor do we hope that we get there. But I think that the residents need to understand that we only do this to ensure that these rules, these requirements must be followed. This is not optional. This is not something we'll think about. This is something we're doing. And as a result, we will put whatever measures are necessary beyond this to ensure that it gets followed. But at this stage, I'm counting on New Brunswickers to recognize if this wasn't serious, I wouldn't be doing this. And that is the reason that we're doing this declaration today, to further confirm just how serious a situation we are in.
Do you have a follow-up?
Yeah, what would those potential additional measures look like at this point? Obviously, this is pretty far-reaching as a declaration. What more additional measures could be on the table?
Well, I think at this stage, what we're saying is the measures we put in place in the communique that we'll have today identifies very clearly, the areas that we're concerned that we need to follow. And I think it's clear that we expect businesses that are not public-facing to be able to continue to operate at the same time protecting their employees, because it's a must that they might do so. So that's not optional. But to get further beyond that as to what would be required for, I guess, in the terms of enforcement, again, I say I hope we're not into that stage, because every New Brunswicker is going to understand how important this is, and the necessity of doing this is to protect their own health and their family members' health and their grandparents' health and their neighbors' health. And so it's nothing more than being able to ensure the health and safety of our citizens.
Thank you. Matthew Wacomo, Lackady Nouvelle.
Hi, Premier. I understand that we'll get more information about this later, but I think a lot of parents and maybe also a lot of daycare operators would like to get an update on the fees and what's going on with all this, because there's some we're hearing some different messages and some people that are quite angry with the situation and the idea of maybe getting charged even if they're not getting the service and stuff like that.
Yes, Matthew, and tomorrow there's going to be a full technical briefing on the daycare discussion and who pays and who doesn't and how that's all going to work. So all the details will be brought out in that technical review tomorrow. So I won't get into those facts, but every question will be answered. I think it's important to in all of the financial consideration, because it goes far-reaching into every aspect of what people do in their daily lives. And that's why I wanted to take the time to understand in terms of the financial aid package exactly what that means, and then we can understand, are there any gaps? How do we address those gaps? So tomorrow our goal will be to provide a more comprehensive package. But on the daycare situation particularly, there's a technical brief plan for tomorrow morning, and all those questions will be answered in detail.
Thank you. Matthew, Action Suivi, do you have a follow-up question?
Yes, Mr. Premier, can you maybe tell us if every essential worker that needs a space in a daycare right now is getting it?
That's certainly our goal because it's a requirement.
Hello?
It absolutely is a requirement, so we want to be sure that every essential worker that needs daycare will indeed get it. That is a must, and that is our goal.
Thank you. Elizabeth Fraser, CBC.
Hi there. My question is for the Premier. I'm still trying to understand how these measures that are in place, how will they be enforced, and what will be the penalty if they're not followed?
I think the point of doing this at this stage is ramping up the idea that it seemed to be prevalent in the community. I mean, we'd certainly see a reduced activity. There seemed to be some confusion of whether it was optional or not optional. I think today's declaration is very clearly stated and understood. This is not optional. So first and foremost, if someone thinks it's okay to just carry on with large crowds gathering or events planned as usual, that is not an optional. It is a requirement now not to do so. Now, I'll repeat what I said earlier. I'm optimistic that New Brunswickers will take this seriously. We're doing this to not get ourselves in a situation like we've seen in Europe and like we're seeing in other countries. We want to avoid that. So I will right now stay on the side of I'm hoping this raises the level of urgency enough that people take it like we must do this. We cannot consider that party we plan to go to next Saturday night as a normal activity because that is not normal anymore. Now, beyond that, we will be assessing, are people listening? Are they paying attention or are they actually putting people at risk? And then we'll decide from there next steps. Right now, it's just this is no longer a request. This is a mandatory requirement.
Thank you. Elizabeth, do you have a follow-up?
Yes, I do. This is for Dr. Russell. We asked the other day what requirements are in place for people who suspect they have COVID-19 to tell their employer and get tested, and what people can do if they suspect a colleague has COVID-19 but isn't getting tested. We respectfully ask that question again. Doctors are obligated to report cases for the public's protection. Are there no requirements for self-reporting or social reporting?
Well, I think the answer that I gave the other day, I believe, was around the fact that in any situation where somebody is not well and shouldn't be reporting to work, that's between them and their employer. But obviously in this situation, that employee, you're talking about somebody who has symptoms and has reported to work despite that fact?
Sorry?
The question you're asking is around if somebody reports to their workplace and has symptoms?
Yes, and so are there no requirements though for self-reporting or social reporting? Like where can people go?
Again, I think that the workplace setting is that it's the employer who would have jurisdiction over that particular situation in terms of they're in a workplace situation and their employer would be able to direct them to go home and self-isolate and call 811. I think that's what would happen.
We're still wondering, these confirmed cases, where are they in the province? What areas?
Yeah, I've given that information. It's 3 different zones, is my understanding. So the central part of the province, the southern part of the province, and the southeastern part of the province.
Thank you, Elizabeth. Mike Cameron, CTV.
Thank you, Bruce. This is a question for the Premier, first off. Premier, you sound disappointed, even angry with some New Brunswickers who are not complying with, or were not complying with the recommended closings. I'm wondering, could you tell us who was not, what did you see in terms of non-compliance? Who did you see not complying with your recommendations that made you so disappointed and angry?
Well, I don't want to, I guess, highlight the disappointed and angry part. The concern part, I would certainly want to make reference to my concern. If you go by a shopping mall, you go by some of the bigger stores and you see lots of cars in the parking lot, you know how many people are buying groceries and how many people are still retail shopping as they once were. You know, the case of some of the confusions around restaurants, so some were open, you know, and trying to manage the actual distancing, but I think the activity was really had gone down a lot. So in the case of looking at this and saying, all right, let's be clear, I talked to the Restaurant Association, I talked to the Canadian Federation of Independent Business folks, I talked to, you know, the manufacturing group, construction industry. So the idea was getting clarity, and we'll continue to do that as we roll along. But where we see people getting together as usual, where we see people feeling like, you know, people are coming home and they're getting together with their friends as they always did, that's the time that we need to think of, okay, how do we change the game? So changing the messaging here and declaring the state of emergency raises the bar higher. It brings a sense of urgency that this is not a game. This is not just, as I said, yeah, it's not an exercise. This is real time, real life, and real life and death situations that we want to make sure that we are minimizing risk to New Brunswickers. And I'd like to just add also that one of the big risks that has been pointed out that not related to the retail business has been related to the many snowbirds returning home from the south. And the fact that, you know, they're coming into airports or they're driving back home and being picked up by family and friends just as they would normally. And then be going home. So now their family and friends they're supposed to go in self-isolation, but their family and friends are now potentially, you know, impacted. So let's just think about the day-to-day activities that we have underway. And what do I need to change to ensure that I'm not being exposed or I'm not exposing somebody else? And those are the concerns. It's not an anger, it's a concern that we believe that, oh, it won't happen to me. And you know what? It's happened to a lot of people. And right now, folks in Italy are saying, I wish I'd have paid more attention. So I want people in New Brunswick to be ahead of the curve and pay a whole lot of attention and do it in time.
Thank you. Mike, do you have a follow-up?
Yes, I do, Bruce. Thank you. This is for Dr. Russell. We know that you and the Premier have been asking people not to contact 811 with unnecessary calls. Now, we've been told that some people calling 811 with possible symptoms have to wait 3 days for a nurse to get back to them to decide if they should be tested. Is that the status of 811 right now, a 3-day lag between call and call back? And if you have any concern about that?
So my understanding is that there are additional resources being put in place today to address that.
Thank you, Mike. Vicki Hogarth, Charlotte County TV.
Yes, I have a follow-up from yesterday's question. Now that it's a state of emergency and without revealing identities, are you now informing municipal leaders if they have cases in their communities so that they can take greater emergency measures?
I guess, I don't know if that was for me or the Dr. Russell, but it's Blaine here. In relation to the state of the emergency, it doesn't change anything particularly for information that's being shared back and forth, but it just changes the height of awareness that the province is putting on this situation, and expecting that civic leaders as well as any leaders throughout the province are taking the necessary precautions in their communities to ensure that rules are being followed.
Vicki, do you have a follow-up?
Yes, it's for Dr. Russell. Do we know how many ventilators we have in New Brunswick, and do we have efforts to get more?
So my understanding through my connections with the Emergency Operations Committee and the RHAs is that New Brunswick has one of the highest number of acute care beds per capita in the country. And so we're moving ADLC patients, so we really want to make sure that we have the right capacity to deal with this outbreak. And the RHAs are in the process of finalizing the number of ventilators that will be available, and as well the additional units that they will be able to order and that staff will be able to operate to deal with this outbreak. So that will be available tomorrow. And it's taking additional time as they're implementing their pandemic plans, which included the repurposing of equipment and staff across the network.
Thank you. Danielle McCready, CBC.
Hi, I have a question for the Premier. We are hearing reports of healthcare workers going back to work after returning from international travel without self-isolating for 14 days. We are also even hearing that they're being instructed to do so. I guess, what can you tell us about that?
Well, I'd be very comfortable in saying that they're not being instructed to do so. I mean, that is part of our protocol. So there are no additional rules that don't apply to them that don't apply to everybody else. I mean, everyone has to self-isolate for 14 days. We are asking people to return into the healthcare profession if they have that opportunity, but we want to ensure they're healthy in doing so. So there are no special exceptions there in that regard.
Danielle, do you have a follow-up?
Yes, I do, Bruce. We've also been hearing from multiple people who are working in call centers that they are continuing to operate as normal without any social distancing efforts. I guess, given this new announcement that there is a state of emergency declared, will call centers be ordered to close?
I would say that it's very clear that it's no longer a voluntary exercise. So we expect contact centers and any other activity to fully comply with the safe distancing requirement. So there should be any confusion, and every employee has the right to say, I need to be within a safe distance according to the rules required by the government and the health authorities, and as dictated by the health office. We would expect them to comply. We expect that businesses still need to find a way to operate and to run, and they will need to keep essential workers to do that. But we're asking businesses to define what the essential worker requirement is. We've talked here this morning about the public facing, so we don't have impact from the public coming and going in businesses, so we need to stop that. But businesses and a call center that do not meet the required distancing need to change their configuration to ensure that they do so.
Thank you. Angel of APTA.
Hello, this question is for the Premier. Now that the province is under a state of emergency, what is the provincial government doing to help Indigenous communities prepare for this?
Well, certainly our organization, the AMO organization, is spread out all across the province and are in touch with the civic leaders, the mayors and councils, in what we're doing. The idea of what the impact is financially is feeding back into the government. So we're assessing that for both businesses and other services in a community, whether it be through shelters, through food, whether it be through food banks, soup kitchens, any activities that our community is currently providing that's being negatively impacted by the restrictions required to protect health are being assessed. And we, as I said in a previous announcement a few days ago, we will ensure that we provide the necessary assistance, whether it be financially or whether it be through personnel, to make sure that impacted communities are kept whole, individuals are protected, both for their well-being in health and in their capabilities to survive.
Angel, do you have a follow-up?
Yes, I do. A couple days ago, Prime Minister Trudeau announced his package of $300 million, and he said that Indigenous communities are at higher risk across the country. So what is the province of New Brunswick doing to prepare this when it does hit with communities? Is there going to be more health workers, or is there more testing kits prepared? And what about the treatments at these at-risk groups?
So there may be, I'll let Dr. Russell take this question, but in terms of us in doing all of these mitigating efforts to minimize the impact, our goal is to manage this, flatten this curve so we can stay within the capabilities of our health system. We're seeing a lot of action happening now within the system in order to control this and not let it get to a point where decisions have to be made that are, let's say a necessity rather than just part of the routine business. We believe we have adequate supplies to meet this challenge, but we need people to pay attention in order to see that the challenge doesn't exceed what our expectations are unnecessarily because people aren't following the rules. So I feel pretty comfortable that, we can do this if people just listen and start to take it very seriously.
Thank you. Andrew Waugh, Brunswick News.
Premier, so you're saying right now that you're just going to kind of watch what's going on and see if this makes any difference. Can you tell us exactly how it is that you're going to watch them, and you're going to have workers driving around looking at what people are doing, and at what point are you going to decide, okay, we're not going to take this anymore, we're going to start finding people or arresting them or whatever?
Well, I think the observation part of that, Andrew, in terms of surveillance and understanding if the communities are indeed responding, we will absolutely be surveying the situation. We'll be monitoring activities in public spaces and understanding if this is being followed. So I'll be asking every community to do that, whether it be police officers or whether it be health officers that will be in the community just keeping their eyes open. And that can be anybody. That can be anybody from government officials in an official capacity or citizens that basically feel that, we're not following the rules in this community as well as we could be. So we're really asking everyone to be eyes and ears on the ground to help us understand that we are meeting the requirements and we are following the rules and minimizing risks to each other. I have another point I just need to raise, and it has relation to, I think when I was reading my document in relation to the construction activity, I wanted to reinforce that construction activity is not prohibited. I think I read it like it was. Construction activity is not prohibited. We expect that we will continue. We need to allow people to continue to do their work. The point that's being made here is simply, if it's a forward-facing business, if it's a public-facing business, so the office where people might come in and out, or work can be done at home in such cases. But we recognize that construction workers, fabrication shops, industries that are not in the public view day in, day out, or have exposure, need to operate. We need to keep as much moving as we can in the economy, and that does not constitute any particular risk. And in these facilities, we are asking companies to do a self-assessment, identify essential workers, and identify those workers that can be protected, go to work every day, and meet the health requirements that are now being imposed.
Andrew, did you have a follow-up?
I did. MB Liquor and Cannabis MB, CPEI shut them down as of this afternoon. Can you just talk to me about why they're staying open and whether they're going to have any reduced hours?
The hours are being changed. The activity within the stores is being changed in terms of how many people can get in. They are basically respecting the distance and requirements and the numbers in the stores. The concern is that this turns into a black market situation, and we end up with more problems that we have greater difficulty to try to manage. So at this time, we've decided we would continue to operate the stores. We continue to operate within the health guidelines, and we provide that service to the public. But again, like everything else, it'll be monitored. And if indeed it becomes a situation that we cannot operate within the health and safety guidelines, we'll make changes.
Thank you. Angel, Dr. Russell would like to, I cut her off by mistake. She would like to respond to your question.
Thank you.
Could you please repeat it for the doctor?
First part of the second part.
I believe it was the second part about First Nations
Yes.
access.
Yes. I was about testing kits and what will happen when the infection starts. When the community starts coming affected, will there be more health professionals in the communities? Because when, it's pretty much being expected across the country, when it starts, it's going to get worse before it gets better. And all First Nations communities are expected to be hit the hardest. And in the case of the pandemic, of course, that attention needs to be paid for their sake and everyone else's sake. So what are the precautions and what's prepared to deal with this when it happens?
So because this is a really rapidly evolving situation, the measures that are in place right now allow us to kind of hit the pause button to see what effects these have, because when you look at mathematical modeling and projections and pandemic planning, there are many, many factors that are taken into account when things are unfolding so rapidly. So at this moment in time, we have a certain number of cases, and we don't see community transmission at this point in time, but we expect to see it. And this breathing space that we have that protects our healthcare system right now is allowing us to gather more information. A lot of the modeling that's happened right now happened out of China. We have some from the Public Health Agency of Canada, but the real-time data that we're getting in Canada around hospitalization, lengths of stays, and those kind of things will be very, very important when we look at whatever other things we need to put in place as things unfold. Again, we expect to see more travel-related cases. That, I think, will still continue to happen along with clusters of close contacts. And we'll still continue our contact tracing and the self-isolation pieces. But the fact that we have these measures in place, I think, will definitely slow down the number of new cases, but it'll also slow down the onset of community transmission. So we definitely have time right now to take into account all the new information that we're seeing and really have a good idea and a good sense of what other things we may need to do moving forward.
Thank you. Michel Corriveau, Radio-Canada.
J'ai une question pour Dr. Russell. J'aimerais savoir, Dr. Russell, est-ce que vous estimez que les mesures annoncées aujourd'hui, c'est-à-dire l'état d'urgence, sont nécessaires et pourquoi?
Alors, durant la semaine, on avait déjà fait des annonces pour les recommandations et je croyais à ce moment-là que les recommandations étaient nécessaires pour les deux raisons que je viens juste de parler. Alors, ça veut dire que aplatir la courbe, on va ralentir le nombre de cas et la transmission dans la communauté. Alors, ces mesures-là qu'on prend maintenant pour éviter trop nombreux de cas, trop nombreux des situations que les hôpitaux, le système de santé, les médecins, les infirmières, ça nous donne un peu de temps pour vraiment assesser la situation, pour dire, OK, on se prépare, on continue à préparer et on peut réagir au fur et à mesure que d'autres informations qu'on reçoit d'autres informations. Alors, les recommandations pour les renforcer à ce moment-ci, pour dire que c'est un changement, que c'est requis maintenant, c'est vraiment un message aux tous les Néo-Brunswickois que protéger le système de santé à ce moment-ci, protéger les médecins, protéger les infirmières et avoir une chance de vraiment réagir dans un temps on va aplatir la courbe à ce moment-ci.
Michel Corriveau, last follow-up question. Thank you.
Hey! Hello?
Yes, go.
Ah, okay.
Vas-y.
I have a question. Sorry.
I didn't cut you off. Vas-y.
Can you hear me now?
Oui, monsieur.
I have a question for Premier Higgs. Premier Higgs, I would like to know, would it be possible eventually to have sanctions like those announced yesterday in Newfoundland? Sanctions that seems quite a deterrent.
I guess we should leave that anything is possible. I won't take anything off the table as such, but at this stage we feel very confident in what we're proposing and developing the severity level higher in relation to actions needed to be taken, not in relation to the health barometer as such. I leave that to Dr. Russell. What I am trying to do here is raise the sense of urgency, and so people take it seriously before it becomes more serious than we're able to manage. And today, I'm convinced we can manage it if we react accordingly.
Thank you very much. We'd like to thank the members of the media. Merci beaucoup tout le monde. D'avoir remercié les membres de médias. This terminates today's session. Certains cette session. Merci.